So I notice a lot of problems happen when we're trying to stage pressure ulcers. And the two I don't find a lot of problems with is differentiating between stage 1 and stage 4, for example, because they're distinctive. So stage 1 is redness of the skin. It's non-blanchable. It cannot be open, okay? If it's open, if it's slightly open, then it's not stage 1 anymore, okay? It's redness, that's non-blanchable. That's all it is. There's no drainage. You can't see the wound bed, none of that. And stage 4 now, that's like the other extreme, is when you see muscle and bone sticking out of the wound. So that's, of course, your stage 4. Now, the problem happened when distinguishing between stage 2 and stage 3, because they can be a little bit confusing. So stage 2 now is one step ahead of stage 1. It's when it's slightly open, so you can see some pink tissue, which is called granulating tissue. You can see some granulation in there, okay? Not too much now, otherwise it'll be called hypergranulated. But it's not all granulation, but you can see some granulation in there. And that's your stage 2, okay? There's minimal drainage and absolutely no slough, absolutely no eschar, okay? Now, the minute you see any slough or any eschar in your wound bed, now you know you are not in stage 2 anymore. You have moved, unfortunately, to stage 3, okay? And I see that getting confused a lot. Even sometimes there will be muscle noticed, and it will still be called stage 2 and stage 3, you know? So stage 3 is when you have any kind of slough. It can be as little as 10% of the wound bed. It doesn't matter. It is a stage 3, because what distinguishes these two is the presence of non-viable tissue, which is your slough and eschar. And slough, I know a lot of people look for the yellow, right? But it doesn't have to be yellow. You know, it can be yellow. It can be kind of gray, kind of light gray. That slough. I've seen it in so many different weird colors too. You're like, what is that? And then you try to remove it, and as you're debriding it, it comes off. So that's your slough, okay? Eschar is your black tissue and kind of like brownish. It can be hard, it can be soft, but that's definitely, you are in stage 2. You are in stage 3 when you see slough and eschar. So don't confuse these two.